Welcome back to our channel, your go-to source for health and wellness tips. Today, we're diving into the world of supplements, and we'll be talking about one that's been creating a lot of buzz lately, Berberine. Whether you've heard about its benefits for blood sugar control, weight loss, or heart health, we'll cover everything you need to know. We'll also discuss how it works, the scientific evidence behind its benefits, the best ways to take it, and even its potential side effects. So, if you're curious about whether Berberine is right for you, stick around. First, let's answer the question, what is berberine? Berberine is a bioactive compound extracted from various plants, including golden seal, barberry, and Oregon grape. It's been used for thousands of years in traditional Chinese and Ayurvedic medicine to treat various conditions, from digestive issues to infections. But in modern science, berberine has gained attention for its potential to support metabolic health, improve heart health, and regulate blood sugar levels. Berberine is classified as an alkaloid and has a vibrant yellow color, often used as a natural dye. It is available in forms such as capsules, powders, or tinctures. Now, let's explore how berberine works in your body. Berberine affects the body at a molecular level, targeting specific biological pathways. It activates an enzyme called AMP-activated protein kinase, often referred to as the body's metabolic master switch. This enzyme plays a crucial role in energy balance, improving insulin sensitivity, and regulating blood sugar levels. Berberine alters gut microbiota, promoting the growth of beneficial bacteria while reducing harmful ones, supporting digestion and overall metabolic health. It also helps reduce inflammation and oxidative stress, which are linked to chronic diseases like diabetes and heart conditions. Berberine is a versatile natural supplement with scientifically backed health benefits. Let's expand on its key advantages. For blood sugar control, berberine activates the AMPK enzyme, enhancing insulin sensitivity, allowing cells to use glucose more effectively, and reducing glucose production in the liver, which lowers fasting blood sugar levels. A study published in Metabolism found that berberine was as effective as metformin in lowering blood sugar levels. Participants saw significant reductions in fasting blood sugar, hemoglobin A1c, and postprandial glucose levels. Regular berberine supplementation can help manage type 2 diabetes and prevent complications like nerve damage, kidney issues, and vision loss. In terms of weight management, berberine boosts metabolism by activating AMPK, increasing energy expenditure and reducing fat storage. It helps regulate hormones involved in fat metabolism, such as leptin and adiponectin. A 12-week study published in Phytomedicine showed that participants who took 500 milligrams of berberine 3 times a day lost an average of 5 pounds and experienced a significant reduction in body fat percentage. Berberine can help with sustainable weight loss and fat reduction when combined with a healthy diet and exercise. Regarding heart health, berberine lowers LDL cholesterol and triglycerides, which contribute to plaque buildup in arteries. It increases HDL cholesterol and improves blood flow by relaxing blood vessels. It also reduces inflammation and oxidative stress, protecting the cardiovascular system. Research published in Cardiovascular Pharmacology showed that berberine supplementation significantly improved lipid profiles in participants with high cholesterol. Another study demonstrated that berberine improved endothelial function, reducing the risk of hypertension and heart disease. Berberine is a natural alternative or complement to statins for managing cholesterol levels and supporting overall heart health. Gut health is essential for overall well-being. Berberine modulates gut microbiota, promoting the growth of beneficial bacteria such as Bifidobacterium and Lactobacillus. It has antimicrobial properties that help eliminate harmful pathogens in the gut. The benefits include improved digestion and reduced symptoms like bloating, diarrhea, and irritable bowel syndrome, IBS. It also enhances gut barrier function, reducing the risk of leaky gut syndrome. Scientific support comes from a study in gut microbes that revealed berberine reshaped gut microbiota composition, leading to improved metabolic outcomes in individuals with type 2 diabetes. Berberine supports gut health, which is crucial for digestion, nutrient absorption, and immune system function. Berberine also has anti-inflammatory properties. It inhibits pro-inflammatory pathways such as NF-kappa B, which is linked to chronic inflammation, and reduces levels of inflammatory markers like CRP and TNF-alpha. The benefits include helping manage chronic conditions such as arthritis, inflammatory bowel disease, and autoimmune disorders, as well as reducing inflammation-related damage in conditions like diabetes and cardiovascular disease. A review in Biochemical Pharmacology highlighted berberine's ability to lower systemic inflammation, making it a promising therapeutic agent for various chronic diseases. Berberine offers relief for individuals with inflammation-related conditions, improving overall quality of life. Emerging benefits of berberine include cognitive function, where early research suggests it may improve brain health by reducing neuroinflammation and supporting neurotransmitter balance. In liver health, berberine aids in reducing fatty liver disease by lowering liver fat and improving liver enzyme levels. For polycystic ovary syndrome, PCOS, berberine has shown potential to improve insulin sensitivity and regulate menstrual cycles in women with PCOS. In summary, berberine offers a wide array of health benefits, from regulating blood sugar and supporting weight loss to enhancing heart and gut health. However, its effects are most pronounced when paired with a healthy lifestyle, including proper diet and exercise. Now, how can you incorporate berberine into your routine? Most studies recommend a dose of 500 mg, 2 to 3 times a day, totaling 1,000 to 1,500 mg per day. It's best taken with meals to reduce the risk of digestive discomfort. Consistency is key, as berberine takes time to show its effects, often requiring 4 to 8 weeks of consistent use for noticeable benefits. Like any supplement, berberine isn't without potential side effects. Common side effects include nausea, stomach cramps, and diarrhea or constipation. Rare but serious risks include drug interactions, as berberine can interact with medications, especially those for diabetes, cholesterol, and blood pressure. Always consult your doctor before starting. It is not recommended during pregnancy or breastfeeding, as it may harm the baby. Long-term use may lead to changes in gut bacteria, so cycling the supplement or taking breaks is often recommended. Let's look at some of the research supporting berberine's benefits. A study in metabolism found that berberine significantly reduced blood sugar and hemoglobin A1C levels in diabetic patients. Research in the Journal of Clinical Endocrinology showed that berberine improved lipid profiles in individuals with high cholesterol. A review in Phytomedicine highlighted berberine's potential to reduce inflammation and oxidative stress. While berberine offers many health benefits, it is not suitable for everyone. Pregnant or breastfeeding women should avoid it, as berberine can cross the placenta and may affect fetal development. Studies suggest it could cause uterine contractions or affect the baby's liver. During breastfeeding, berberine can pass into breast milk, potentially causing harm to the infant. Potential risks may lead to kernicterus, a type of brain damage caused by high bilirubin levels in newborns. Could disrupt normal growth and development in babies. People taking medications. Berberine has strong interactions with several types of medications. Diabetes medications. Berberine lowers blood sugar levels, which can lead to hypoglycemia, dangerously low blood sugar, when combined with diabetes drugs like metformin, insulin, or sulfonylureas. Symptoms of hypoglycemia include shakiness, confusion, dizziness, and even loss of consciousness. Blood pressure medications. Berberine can also lower blood pressure, so combining it with antihypertensive drugs might cause blood pressure to drop too low, hypotension. Symptoms of hypotension include lightheadedness, fainting, and fatigue. Anticoagulants, blood thinners. Berberine has mild blood thinning properties. Taking it with medications like warfarin, aspirin, or heparin may increase the risk of bleeding or bruising. Warning signs include unusual bleeding, blood in urine or stool, and prolonged bleeding from cuts. Cytochrome P450 inhibitors. Berberine interferes with liver enzymes, CYP2D6, CYP3A4, that metabolize many drugs. This interaction can cause drugs to accumulate in the body, leading to toxicity. People with liver or kidney issues should avoid berberine as it is metabolized in the liver and excreted by the kidneys. If these organs are not functioning properly, the supplement can build up in the body, leading to toxic effects. Potential risks include worsening of existing liver or kidney conditions and increased likelihood of side effects like jaundice, fatigue, or swelling. People with low blood pressure or hypoglycemia should avoid berberine's ability to lower blood sugar and blood pressure, which can exacerbate these conditions, leading to fainting, confusion, or other serious complications. Potential risks include dangerous drops in blood sugar, especially in non-diabetics with naturally low blood sugar levels, and excessively low blood pressure, causing dizziness or fainting spells. Individuals with gastrointestinal sensitivities should avoid berberine as it can irritate the gastrointestinal, GI, tract, causing symptoms like nausea, diarrhea, or abdominal cramps, especially in sensitive individuals. Potential risks include worsening of conditions like irritable bowel syndrome, IBS, or inflammatory bowel disease, IBD. Children and adolescents should avoid berberine due to limited research on the safety of berberine in younger populations. Growing bodies may respond differently to bioactive compounds, and berberine's effects on development are not well studied. Potential risks include unknown effects on growth, metabolism, and organ development. Additional considerations include surgery. Avoid berberine before surgery, as its blood-thinning properties may increase bleeding risk during procedures. Discontinue at least 2 weeks before surgery to allow it to clear from the system. Allergic reactions may occur as some individuals may be allergic to berberine or related compounds. Watch for symptoms like rash, itching, swelling, or difficulty breathing. Key advice: always consult a healthcare provider before starting berberine, especially if you fall into any of these categories. If you are already taking berberine, monitor for any unusual side effects and report them to your doctor. Berberine is a powerful supplement, but its effects and interactions can vary widely depending on individual health conditions and medication use. Final thoughts and FAQs: berberine is a powerful natural supplement with significant health benefits, but it's essential to use it wisely. If you're considering adding berberine to your routine, talk to a healthcare provider to ensure it's safe for you. If you found this video helpful, hit the like button, subscribe, and share it with anyone who might benefit. Leave your questions about berberine in the comments below, and we'll answer them in a future video.